If we can keep the children close to home, I believe not only will it be easier for the families, but I believe the care will actually be better.
I lost my son Jonathan when he was 11 years old. It was a catastrophic diagnosis that came out of the blue. He was diagnosed in September and he passed in April. In that period of time, we had some incredible moments of hope, and he was home for the period of time, and we had to have medical services during that period of time that required an hour plus travel. On one of the trips, he asked me, why do we have to travel so far? And I said, that's a really good question. And when this nonsense is over, we're going to both address that. It didn't work out that way. And so he's gone. I'm here, and in his words, a deal's a deal.
The goal of the pediatric program at Orange Regional is to be able to provide basic pediatric hospitalization services close to home.
We are undertaking a 3-year project raising money for pediatrics. A pediatric emergency department, a redesigned inpatient pediatric unit, and at the end of our project we will have a pediatric intensive care unit.
Really, it's going to be geared towards helping the kids out and making them feel comfortable in the environment.
It allows you to be closer to your home, near the family that you love, the friends that you played with, school that you go to.
We try to minimize their experience in terms of fear. We try to improve their turnover in care and their quality of care. In other words, having physicians and staff who work with children on a day-to-day basis.
If a child is comfortable, feels that the people around them are comfortable, then we can focus more on the needs of that child, the healthcare needs of that child.
With so many families being forced to travel significant distances out of their community for what we consider to be basic hospitalization of pediatric patients, this was an opportunity for us to develop this program.
We're trying to get the community involved in building this program here at Orange Regional. We as physicians and the hospital staff here are very vested and realize we really want to have an excellent program here, and we want the community to have some involvement. We want the program here to work for everybody.
You take ownership of it. This is your hospital. This is your medical center.
It is my passion to ensure that each parent experiences the same outcomes that I have with my children.
I chose to lend a hand for kids, and I think the community as well should lend a hand for kids and help out the hospital.
One more, cornerstone cinder block to build it. It's just, every dollar counts, and everything will move towards this goal.
It takes a community to raise a child. It is time for our community to begin focusing on children's health care locally.
He would probably give me one real high five on that. It would be, yes, it would be real excitement. That I knew we could do it would be his hand, it would be his comment.
Everyone, don't you want to help kids like me? So I want to say, won't you lend a hand for kids?